I'm very delighted to welcome Ray Stubber, Managing Director of VariVac. Thank you so much for joining us today, Ray.
Thank you, Fatima. Yeah, good to be here.
So I'm very excited to actually ask about VariVac. It's been around for 25 years and it's continuously improving. Can you tell us more about how the product came about? Did you reach out to surgeons and nurses to find out what they were missing in the wound drainage management?
Yes. Thanks for the question. Yes, VariVac came about because we're working over the years, working closely in wound management with surgeons and nurses here in Australia. And we were looking for a solution that would encapsulate most surgical procedures. And so the idea was conceived by that. And also some of the briefs from the hospital was to reduce the number of different brands and different devices they have in wound drainage that was clogging up their inventory and causing them to have a lot of different stock on their shelves for different procedures. So that's sort of where we started with that, and the idea of it being a low vacuum system but also a passive system is trying to heal the wound sites in a timely manner and also reducing infections. So.
And the variable vacuum system is very innovative. How would this typically be used on a patient? What settings are recommended and when?
Yes, well, post-operatively, blood loss can be quite generous. Some patients are even heparised during surgery, which causes the blood to flow unrestricted. Our passive setting allows the pressure within the wound site to dictate the amount of drainage. So that we're draining exudate from the patient that is only needed, and this also minimises blood loss. So this is very important, as the exudate flow is controlled by the pressure in the wound site and not so much the device's vacuum. And we can get into that a bit later, but that's the concept of the passive setting. And this setting can also go from, our device can also go from passive onto drainage, onto vacuum, without having to break into the system. So it's a totally closed system.
And post-operative surgical wound drainage is recognized as a critical element in facilitating the healing process. Can you tell us more about how the closed vacuum systems are needed to ensure effective management?
Certainly. A low vacuum drainage system assists in supporting the wound site to heal. So it doesn't promote any bleeding, such as a high vacuum system would. And this causes less trauma post-operatively as well. This then reduces the amount of wound drainage canisters needed. Also, it reduces the less likelihood for any blood transfusions down the track. So instead of high suction units promoting a lot of blood loss, the low vacuum systems seem to work better in most systems. Also, being a closed system, it reduces the risk of outside contamination to clinical staff and also the patients alike. So.
And VariVac is creating a benchmark in safe, controlled wound drainage. Can you speak to us about how patients are benefiting through better outcomes? And in addition, how surgeons and clinicians are finding an improvement during procedures and post-op?
Well, it's very good. Thank you. Yeah, it's well documented that better outcomes are achieved by draining less blood from the patient than is needed, which keeps the patient healthier, less trauma to the wound site, requiring less blood transfusions. So our canisters come pre-vacuumed, ready for direct assembly in the OR. They are large enough and made of a highly transparent polycarbonate, assisting clinical staff in identifying the amount of exudate and the type of exudate within the canister, so they can sort of collect and assess what's there more accurately. Also, the canister made of polycarbonate is robust enough that can take the tough environment if dropped in on hospital floors, or if the patient is ambulatory and also in a home setting. So any loss of vacuum in the system can be charged quite easily, either at the hospital bed using the suction, wall suction, or in a home setting, they can use a catheter tip syringe, which are readily available.
And the VariVac silicone channel drain comes with an innovation that you designed and patented, the Thumb Grip Trocar. Can you explain about how this came into fruition and the reason you believe this would be needed in the wound management market?
Yes, certainly. The thumb grip came about, was designed with safety features in mind through discussions we had with surgeons here in Western Australia also. We've actually placed a scallop in the actual trocar. Probably the easiest thing to do is just to show you, and if you can see that easy enough, but we've actually got a scallop down where the thumb would normally go for the surgeon, and this aids in giving the thumb a rest and also some protection from slipping forward and winding off at the end of the trocar and causing a needle stick injury. So it's a system that was fairly simply designed and developed here, painted, but the surgeons that use it find it has great acceptance here in Australia. Because the surgeon's gloves are generally very slippery in this environment because the gloves are covered in blood, and the stainless steel trocars are very slippery. So yeah, no, it's been something that we designed only a few years ago, but it certainly offers some safety that we are happy to design into a system and try and keep the surgeons safety in mind. So.
Absolutely. And with VariVac canister and VariBlake already in the product line and VariVac Arc in the pipeline, can you tell us about how these products will create a full system of innovative wound drainage solutions?
Well, with our concept, our theme being variable vacuum, we've developed a system, a negative pressure wound therapy system that complements the wound drainage system. So we have our wound drainage canister, which has an adjustment, a vacuum adjustment on the top, and this is adjusting the vacuum in the wound site, within the wound site. And this new system that we've developed is a negative pressure system, and this attaches to a dressing which attaches to the outside of the suture site. So we're healing the inside of the patient and also the outside of the suture site. So we're offering a total healing concept from us, and this is also incorporating different levels of vacuum, which we also have on our canister system. This, whilst it is a single-use system, has a 40-day runtime, and we also have a canister which can be changed if it does fill, similar to our canister that we have in our wound drainage system. So one of these is all you need to require for any single patient use.
That's terrific. Thank you so much for demonstrating how the product works as well.
That's
And lastly, can you tell us more about VariVac's educational endeavors and how it's supporting the healthcare community and organizations?
Well, yes, I mean, on-site in-servicing for clinical staff has always been the core of our sales support. However, as we all know, during COVID times, it's been impossible for any of our sales team or any of our in-service team to get into the hospital. So we developed an in-service video, which we've done in short segments. So a nurse, for instance, on night shift or whatever, with no one else to talk to about, how to remove the drain if she's sort of caught out, he or her's caught sort of offside, they can actually pull up our video very quickly and just go to the segment, whether it be exchanging the canister or be removing the drain from the patient as a complete system, or revacuum the canister. All of these are on our website. I mean, it doesn't replace the face-to-face that we certainly like to do and talk with our clinicians and nursing staff to gather any more data that they need or any features that they would like to see on it. And it's an ongoing improvement. All our systems are ongoing improvement, but at least at this time with COVID, they've got some educational on the website for them.
Well, thank you so much, Ray, again, for this very insightful interview. Would you like to add anything, as your last comments or any messages you'd like to share?
Only that we're certainly looking forward to going to FIME, or you say FIME or FIME?
Fine, yes.
Say FIME here. We're certainly looking forward to going there. We've it's our first time going. We actually enrolled in 2020, and just because of COVID, we haven't been able to go. So yeah, we're looking forward to going to the conference and meeting any distributors throughout North America, and chatting to people over there, and just mixing with the other broader community in the healthcare industry. And we're looking forward to that. So thank you very much for this.
We're very looking forward to welcoming you as well at FIME. Thank you so much again.